How high is too high for blood pressure after 60? Cardiologist warning. Before we begin, there's one question I want you to think about. If you're over 60, one blood pressure number could be giving you a false sense of security. So let me ask you this, how high is too high? Many people believe they are doing well simply because their blood pressure is lower than it was a few years ago. But research and modern cardiology suggest the answer is not always that simple. I'm Dr. Temmy Taylor, and my goal is to help you understand healthy aging through clear, evidence-based information you can use in everyday life. In this video, you'll learn which blood pressure numbers deserve attention, which readings may require urgent medical care, when it's time to call your doctor, and how to better protect your heart and brain as you age. Stay with me until the end because one blood pressure range that many people believe is safe may not be as reassuring as it seems. Before we talk about specific numbers, let's first understand what your blood pressure is actually telling you. Every time your heart beats, it pushes blood through your arteries to deliver oxygen and nutrients to every part of your body. Blood pressure simply measures the force of that blood against the walls of your arteries. The top number, called systolic pressure, shows how much pressure is created when your heart beats. The bottom number, called diastolic pressure. As we get older, our arteries naturally become less flexible. This can cause blood pressure to rise over time. While higher readings become more common after 60, they should never be dismissed as just another part of getting older. Research suggests that keeping blood pressure in a healthy range may help reduce the risk of stroke, heart disease, kidney problems, and memory decline. In today's countdown, we'll separate common myths from current evidence so you can better understand your own numbers. Stay with me until the final section because many people focus on the wrong blood pressure reading while missing the one that may signal the greatest risk. Let's begin with the first mistake almost everyone makes when checking their blood pressure. Many people look at a single blood pressure reading and immediately decide whether their heart is healthy or unhealthy. If the number is higher than expected, they become worried. If it looks normal, they feel completely reassured. But one reading rarely tells the whole story. The reason is surprisingly simple. Blood pressure is not fixed. It naturally rises and falls throughout the day. It can change depending on whether you've just climbed the stairs, had a cup of coffee, felt stressed, exercised, or even had a poor night's sleep. This means one reading is only a snapshot of what your blood pressure was doing at that moment. Research has shown that healthcare providers usually do not diagnose high blood pressure from a single measurement alone. Instead, they look for a pattern over time. That is because repeated readings taken under similar conditions provide a much clearer picture of how your heart and blood vessels are really working. Relying on one number can lead to unnecessary worry if the reading happens to be temporarily high. It can also create false reassurance if the reading is unusually low on a day when your blood pressure is normally elevated. In some cases, this may even delay treatment because a serious problem is missed until much later. A better approach is to measure your blood pressure the same way each time. Sit quietly for about 5 minutes before checking it. Use the same arm whenever possible, and try to measure it at similar times each day. Keep a simple record of your readings and share it with your doctor or healthcare provider. Looking at the trend over weeks is often much more helpful than focusing on a single number. But even accurate readings can be misleading if you don't know which number matters most. The second mistake is focusing only on the top number while ignoring the bottom one. Many people can quickly tell you their systolic pressure, but they have no idea what their diastolic pressure is. That is understandable because the top number usually gets the most attention during doctor visits, health articles, and television programs. However, both numbers tell an important part of your heart story. The systolic number measures the pressure in your arteries when your heart squeezes and pumps blood through your body. The diastolic number measures the pressure while your heart relaxes between beats. Even though your heart is resting during that short moment, your arteries and organs are still receiving blood. Research suggests that both numbers can provide valuable information about your heart and blood vessels. A high systolic pressure may increase the risk of problems such as stroke, heart disease, and kidney damage over time. At the same time, a diastolic pressure that is too high may also place extra strain on the heart and blood vessels. In some situations, a diastolic pressure that becomes too low can reduce blood flow to important organs, especially in some older adults. This is one reason healthcare providers look at both numbers instead of just one. If you pay attention only to the top number, you could miss warning signs that deserve a closer look. On the other hand, focusing on one number alone may also cause unnecessary concern when the complete picture is more reassuring. Your blood pressure reading works as a pair, and each number helps explain what is happening inside your body. The next time you check your blood pressure, take a moment to understand both numbers instead of looking at only one. If either number raises questions, discuss your readings with your doctor or healthcare provider. Together, they can help you understand what your results mean for your personal health. Now let's answer the question you've probably been waiting for. How high is too high? The truth is that many people are looking for one magic number. They want to know the exact point where blood pressure suddenly becomes dangerous. But research shows the answer is more gradual than that. The higher your blood pressure stays over time, the more strain it places on your heart, blood vessels, kidneys, and brain. One reason people become confused is that they often find different numbers online. Some articles mention one target, while others suggest another. This can make it hard to know which advice to trust. The reason for these differences is that blood pressure goals are not exactly the same for everyone. Your age, overall health, medical history, and other conditions all play an important role. In general, blood pressure is grouped into simple categories. A normal reading is below 120/80. An elevated reading means the top number is between 120 and 129 while the bottom number stays below 80. High blood pressure, also called hypertension, usually begins at 130/80 or higher according to many current guidelines. However, your healthcare provider may recommend a different target based on your personal needs. This matters because high blood pressure often causes no warning signs. You may feel perfectly well while extra pressure is quietly damaging your arteries. Over time, this may increase the risk of stroke, heart disease, kidney damage, vision problems, and memory decline. That is why high blood pressure is sometimes called a silent condition. Instead of comparing your numbers with a friend or family member, focus on understanding your own target range. Work with your doctor or healthcare provider to decide what is safest for you. A blood pressure goal that is right for one person may not be the best choice for someone else. But high blood pressure isn't the only number that deserves attention. Many people believe that the lower their blood pressure is, the healthier they must be. That sounds reasonable because we often hear about the dangers of high blood pressure. But the truth is that blood pressure can also become too low for some people, especially as they get older. This misunderstanding happens because lowering high blood pressure is an important part of protecting the heart. As a result, some people assume that the lower the number, the better. But your body needs enough blood pressure to deliver oxygen and nutrients to your brain, heart, kidneys, and other organs. If your blood pressure drops too much, those organs may not receive the blood they need. Research suggests that low blood pressure is more likely to cause problems when it is combined with symptoms. Common causes include dehydration, certain medications, standing up too quickly, heart conditions, or other medical problems. Some people naturally have lower blood pressure and feel perfectly well. Others may develop symptoms because their blood pressure has fallen below what their body needs. When blood pressure becomes too low, you may notice dizziness when you stand up, blurred vision, weakness, fainting, or trouble thinking clearly. These symptoms can increase the risk of falls and injuries, which become more serious as we age. In some cases, repeated episodes of low blood pressure may reduce a person's confidence to stay active and independent. This is why your symptoms are just as important as the numbers on the blood pressure monitor. If you regularly feel dizzy, lightheaded, or faint, make a note of when it happens and what your blood pressure reading was at the time. Sharing both the reading and your symptoms with your doctor or healthcare provider can help them find the cause and decide whether your treatment needs to be adjusted. Another mistake can make even a normal reading look dangerously high. Before we continue, thank you for spending your time with me today. If you're finding this information helpful, please subscribe for more evidence-based videos on healthy aging, heart health, and practical ways to stay active and independent. I also have a free blood pressure tracking log and heart health guide that can help you keep a clear record of your readings and build healthier daily habits. You can find them in the description below. Now, let's continue our countdown with another mistake that can change your blood pressure reading more than you might expect. Section 5. Another common mistake has nothing to do with your heart. It has to do with how you measure your blood pressure. Even a healthy reading can look too high or too low if it is taken the wrong way. The surprising part is that most people have never been taught the correct technique. Small mistakes may seem unimportant, but research shows they can change your reading enough to cause confusion. For example, talking during the test, crossing your legs, or checking your blood pressure right after walking across the room can cause the numbers to rise. Using a cuff that is too small or too large may also produce inaccurate results. Before taking your blood pressure, sit quietly for at least 5 minutes. Rest in a chair with your back supported and both feet flat on the floor. Avoid crossing your legs. Place your arm on a table so the cuff is level with your heart. Wrap the cuff snugly around your upper arm, following the instructions that come with your monitor. During the measurement, stay still and avoid talking until the reading is complete. These simple steps help your monitor measure your blood pressure more accurately. Without them, you could think your blood pressure is getting worse when it is not. That may lead to unnecessary worry or even changes to your medication that are not actually needed. On the other hand, an incorrect reading that looks lower than it really is could delay important treatment. The best approach is to follow the same routine every time you check your blood pressure. Measure it under similar conditions, use the same arm, and record your readings in a notebook or tracking app. A consistent routine gives your healthcare provider more reliable information and makes it easier to spot real changes over time instead of normal day-to-day variation. The next section explains why your lifestyle may matter more than one single reading. Many people believe that once they start taking blood pressure medicine, there is little else they need to do. Medication can be very important, but it works best when it is supported by healthy daily habits. The choices you make each day can quietly influence your blood pressure, even if you don't notice the effects right away. One of the biggest factors is the amount of sodium, or salt, in your diet. Eating too much sodium can cause your body to hold on to extra fluid. This increases the amount of work your heart must do and may raise blood pressure over time. Choosing more fresh foods and fewer highly processed foods can help reduce your sodium intake. Regular physical activity also plays an important role. Research suggests that moving your body most days of the week may help your heart become stronger and your blood vessels work more efficiently. Even a brisk walk, gentle cycling, or swimming can make a difference when done consistently. Sleep is another habit that is often overlooked. Poor sleep or not getting enough rest may place extra stress on the body. Long-term stress can have a similar effect by increasing hormones that may cause blood pressure to rise. Finding healthy ways to relax, such as deep breathing, spending time outdoors, or talking with loved ones, may help support heart health. Maintaining a healthy weight can also reduce the strain on your heart. In addition, limiting alcohol and avoiding tobacco are two important steps that research has linked with better cardiovascular health. These changes do not have to happen all at once. In fact, trying to change everything overnight often becomes overwhelming. Instead, choose one habit you can improve this week. Perhaps you could take a short walk after dinner, reduce salty snacks, or aim for a more regular bedtime. Small, steady improvements are easier to maintain, and over time they can add up to meaningful benefits for your heart and overall health. Finally, let's talk about the number that should never be ignored. One of the biggest mistakes people make is waiting too long to seek medical help. This often happens because high blood pressure is known as a silent condition. Even when the numbers become dangerously high, many people still feel perfectly normal. They may think, "I'll wait until tomorrow," or "I'm sure it will come down on its own." The hidden danger is that serious damage can happen before obvious symptoms appear. Research shows that extremely high blood pressure can become a medical emergency, especially when it is accompanied by warning signs. These may include severe chest pain, a sudden and intense headache, shortness of breath, blurred or lost vision, weakness on one side of the body, trouble speaking, confusion, or loss of consciousness. These symptoms should never be ignored because they may signal that important organs are being affected. When blood pressure reaches very high levels, it can place tremendous strain on your blood vessels and vital organs. This may increase the risk of a stroke, heart attack, kidney injury, or permanent vision loss if prompt treatment is delayed. The sooner medical care begins, the better the chance of preventing serious complications. If you ever record an extremely high blood pressure reading, do not focus only on the number. Pay close attention to how you feel. If the reading is very high and you have symptoms such as chest pain, severe headache, difficulty breathing, confusion, weakness, vision changes, or fainting, seek emergency medical care immediately. Do not try to drive yourself if you feel unwell. If possible, have someone call emergency services or take you to the nearest emergency department. Knowing when to act is just as important as knowing your blood pressure numbers. Acting quickly during a medical emergency may protect your brain, your heart, your kidneys, and even your life. So what should you remember every time you check your blood pressure? First, don't rely on a single reading to judge your health. Blood pressure changes throughout the day, so looking at trends over time gives a much clearer picture. Second, pay attention to both numbers, not just the top one. Together, they tell an important story about how your heart and blood vessels are working. Third, know your own target range instead of comparing your readings with someone else's. Your ideal blood pressure depends on your age, your medical history, and your overall health. Fourth, measure your blood pressure the right way so your readings are as accurate as possible. Fifth, remember that daily habits like eating well, staying active, sleeping enough, managing stress, and avoiding tobacco all play an important role in keeping your heart healthy. Finally, learn to recognize the warning signs of a medical emergency and seek help right away if they happen. The good news is that blood pressure is something you can influence. You cannot change your age, but you can make choices each day that support a healthier heart. Research suggests that regular monitoring, healthy habits, and working closely with your healthcare provider may help lower the risk of stroke, heart disease, kidney problems, and other serious complications over time. This week, choose one simple action. Check your blood pressure using the correct technique, write the results down, and bring your record to your next healthcare appointment. A few minutes today can provide valuable information for your future health. Now I'd love to hear from you. What was your most recent blood pressure reading? Which fact surprised you the most in today's video? And what healthy habit has helped you keep your blood pressure under control? Share your experience in the comments because your story may encourage someone else to take better care of their heart. If you found this video helpful, please kindly subscribe and share it with a friend or family member over 60. Understanding these numbers could make a real difference in protecting their health. Finally, remember that this video is for educational purposes only and is not a substitute for personalized medical advice. Blood pressure goals are different for each person based on their medical history and overall health. Always work with your doctor or healthcare provider to determine the target range that is right for you. If you or someone around you develop symptoms such as severe chest pain, sudden weakness, confusion, difficulty breathing, vision changes, or loss of consciousness, seek emergency medical care immediately. Thank you.